To call the Finance Committee to order at 5:40 PM. Thank you to my committee for being here. Thank you to the rest of our colleagues for being here as well. Tonight, we're going to continue our budget hearings. We're going to have Council on Aging, which is on page 115 in the budget book. Assessor, which is page 57. Human Resources, 59. Library, 123. Budget, 38. Citywide, 34. I will repeat them again as we go, but just if people wanted to skip ahead. So, we'll have Mason and Kelly come on over. Again, Council on Aging, page 115.
Two chairs.
Good evening.
Good evening.
Good evening.
Long time no see, Mason. All right, so what we did last time is just gave the department head an opportunity to talk about their budget. If any questions should arise, we could address at that point. The floor is yours.
Thank you, Council. Hi, everybody. Good to see everybody tonight. The Council on Aging has had a really good year in terms of programming and just the great team. I'm really, really fortunate to have an amazing team at the Council on Aging that can support older adults in our city. And one of the major changes that we had this year was to the SHINE program. As we know from last year, we chose not to renew that contract after serving as the regional SHINE office for just shy of 40 years, and that it was too big of a gamble with tax dollars if that funding didn't come through from the feds. So we elected to not renew it, and I'm happy to report that we had 7 people come forward, and they are now certified Medicare navigators. It's the same program, it's just different wrapping is how I describe it. And we're gonna have an incredible bench staff that can focus solely on Attleboro's older adults. And that's what we need to do, because we have more than 11,000 of them. As you know, almost a quarter of our population. So it's important that we have the ability in those skilled people. They are certified. So despite what may be on social media, we did not decimate the SHINE program. We improved it. And it's a new, improved program that still meets the needs of Medicare counseling for older adults. With that, we had we gained a lot of real estate on the second floor because the SHINE program did have that whole back office for those of you that have been there. And it's allowed us to expand programs because within some of the smaller conference rooms that didn't give us enough space to hold some of the programs. So that's why we expanded it. So Courtney and I now share an office, and we've just reconfigured, everything on the second floor to make it better for older adults. So in terms of what's in the budget book, as we know, the COA was one of the departments that does have a cut to personnel, and we are losing a full-time senior clerk. And this individual, I have to give kudos where kudos are due, has really elevated our tax abatement program. We currently have 140 individuals enrolled in that program out of 150, which we know is the max. And she has worked so diligently on establishing really strong working relationships with the various departments and being able to place people, because it's not one size fits all when it comes to that program. And at the end of the day, it's allowing older adults to get that tax break that a lot of them so desperately need in the following year. So personally, it's a loss. It's a loss to our team, and quite frankly, it sucks. But we know this is where we are in these times, and we want to be able to pivot. And we know that the Veterans Department is coming over, but I do have to say to the council, I do have concerns around that and how that is going to play out, because I have to be honest, the union kind of world is not something that I'm familiar with. I came from the nonprofit world, so this is a whole different ballgame. So I'm used to being a team player, and a lot of the folks that work at the COA feel the same way in terms of what do we need to do to meet the needs of Attleboro's older adults. And I'm not sure how that's going to play out. So I just want to say that publicly. We will do the very best that we can to make things as smooth as possible, keeping in mind we're gaining 2 new team members over at the COA. We knew that was a plan for when we moved to Highland, but this is coming earlier than we anticipated, and we've got the tax abatement program. We don't want to lose momentum with that, and all of those relationships that have been established. We'll do whatever we need to do to make it happen. That position also oversees the Greater Boston Food Bank for this area, including all the senior housings and the town of Norton. So that happens over at Good News Bible Chapel, as well as the Hebron Food Pantry. We have a very strong working relationship with them. And Carolyn Woodruff, who is currently the senior clerk at the COA, has really worked on establishing those relationships. So there's something to be said for that in terms of that loss. The other thing
Kelly, before we move on, do you mind if I just ask you a question about the senior clerk? Because it does seem like it's a big loss and the impact. Do you feel as though any of the senior tax abatement program that the senior clerk did, is that something that a volunteer could do, or is that going to be something, so kind of knew the answer, but I think it's an important point to be made. So how's that going to work? I think you're right. I think you have to keep the momentum with that program because it's so important to so many. How do you see that working out? Is fall on you, fall on Courtney, or just kind of be burn that bridge when we get to it?
The idea that I understood when this was first broached is that the person from Veterans is taking on those responsibilities. And I know Lynn's not here yet, but Mason is, and he knows this stuff, that an administrative clerk within a union is able to absorb the tasks or duties of a position that is below, for lack of a better term, that classification. So my understanding was it was going to be the administrative clerk for Veterans that would take that role on.
So I think the goal from the administration, again, there's still discussions ongoing with the union and what the results of that would be. But the goal from the administration's perspective is for the clerical duties of the department to be somewhat more shared, and that's part of what we talk about when we talk about consolidation and sharing of resources and finding efficiencies. The reality with this specific position, extremely valuable. A lot of the duties that they're actually doing aren't necessarily clerical in nature. They're more programmatic. So a lot of those traditionally fall on program individuals or administration. So there might be some duties and responsibilities that shift to other people within the department, while the clerical duties are intended to fall on the clerical staff.
So I guess the concern I have is, and I'm pretty familiar with working with unions, and this position goes over to the administrative clerk. If we're in a world where we wanted to go back to the senior clerk of the COA, it's going to probably be demand a bargain, because now this individual will lose some of the duties that they're doing. So I guess that's something to think about and something to look at.
You're talking about going back to adding a senior clerk down the road?
Yeah, and if we wanted to, if the decision was made to take the responsibilities of senior tax abatement program, once it's already been given to a union employee from a non-union employee, that's going to present challenges of its own. I don't want to necessarily go down that rabbit hole.
There's an aspect of job descriptions there and teasing out what the actual responsibilities are supposed to be of the individual versus what's actually listed in the job description, and that's kind of where the division of those responsibilities have to fall between the staff. But the concept of I think long term, I don't think the goal of the city is to have 2 clerical staff for the long-term needs of the COA and veterans being in a shared location. So I think the financial constraints that we're under have kind of forced us into that situation a little bit sooner than we would have liked. The goal was, when we moved to the new space and consolidate those departments and go for those efficiencies long-term, that would have been the ideal time to make that transition. But I think given the situation we're under, I think it kind of forced some of those decisions a little bit earlier.
Okay. No, thank you, and I appreciate you being forthcoming and just saying about, talking to us about your concerns, because personally, and I don't know about my colleagues, I'd rather hear that up front than, once the train's left the station. The senior clerk, just including fringe and everything else, what's the salary, benefits, the annual cost?
So I don't know if I want to say the exact number because that would telegraph the health insurance plan they're
Sure,
on.
no, I
but
understand that.
yeah, it's about 1.3 times the salary. I mean, we're looking at about 60 to 70 grand.
Okay, thank you. I appreciate that, thank you. Sorry about that, Kelly.
No, quite all right. We appreciate the questions. The other things in terms of the budget is the marketing and events coordinator, which the council was kind enough to elevate from program assistant 2 years ago now. I'm losing track of time.
About 2 years.
That position was split between the general fund and formula, and now it's shifted 100% to the formula fund, so that comes out of the general fund, as does several of the minor, if you will, line items around printing and staff development, mileage, those kinds of things. Those have come out of the general fund as well. So we're looking at, and Mason can correct me if my simple math is wrong, which it likely is that that's about 80,000 that would be coming off of the general fund and into the formula fund. The other changes that we've made is Diane Carlin, who some of you may know, was the nutrition coordinator for many, many years at the COA. She retired at the age of 83. We should all be so lucky to want to work and be able to work until that age. And we made a decision based on the needs of the program that we wouldn't replace a nutrition aide and instead keep the 15-hour nutrition coordinator. So that job is going to be posted. And that will now come out of the COA's revolving fund. So that is coming off the formula fund as well, and going into the revolving fund. I think that is, in terms of the major shifts for line items, that pretty much covers it. There were some minor adjustments to HVAC, utilities, housekeeping, and maintenance, really based on the reality of what we have with the majority of the city buildings, is that they're aging. On a positive note, we have 2 new HVACs that were installed, thanks to Gary and his team, with green energy funds, and we have functioning AC on the first floor. The challenge is, when SS Service Corps came out, just to put everybody on notice, the condenser fan is broken, so they put some kind of piece of cardboard in there, and so we're looking at that. It's about a $2,200 fix to replace that fan. So we're
Is the cardboard working?
so far, Jay. Yeah, so far. So we've got that. The other positive things that I'd like to note, this has to do with collaboration, and from my perspective, in the nonprofit world, collaborations are really key. We already collaborate with the rec department and the library, and we work really well together, particularly around intergenerational programming. And that's something that we've been intentional about expanding. And the other things are the CAR program. I don't know if all of you are familiar with that, but it's something that the schools participate in, the Y, the hospital, the literacy center. And what it does is it provides a backup system for transportation, because not everything can be scheduled through the Dial-A-Ride program or MedWheels. And this affords us the opportunity to do those last minute things. If somebody needs to get to the Social Security office, or if somebody needs to get to an emergent doctor's appointment because something's been rescheduled, now we have the capacity to do that. It's not something that we use on a regular basis, because we don't want people to be reliant on that and then not utilize Dial-A-Ride, because that's the primary mode of transportation for older adults. We've also joined the Stronger Together Alliance that's been in existence for many years, and we're proud to be a part of that. And last but not least, in the coming year, we are part of what's called the Chance Project. That is a consortium of the Literacy Center, the ARC, AAIC, Area Attleboro Interfaith Coalition, and the Y. And that is going to allow us to focus on an outcome of decreasing social isolation amongst older adults. And the way we're going to do that is through hiring peer health navigators. We're going to train them, and then we're going to deploy them into the community so they'll be able to supplement what our outreach team does, along with fire and health, because we work very closely with them as well as the POP team in terms of people that are hoarders, aka collectors. So we feel that that's going to be really beneficial for many, many people. And we're also going to add Chromebooks to that so that we can be able to engage people even remotely. Some people are agoraphobic, they might be bedbound, whatever their situation is that prevents them from coming into the COA, now we can connect with them virtually. So we think that that is a benefit. So despite some of the challenges that are before us, we're up for them, and we're happy to work collaboratively with people that have that same mindset. And we're going to continue to support older adults and empower them in our community.
Kelly, thank you for coming down. You're doing a really great job over there. And, you know, I think this is a theme of this budget will be for everyone is doing more with less. And, you know, it seems like you have a really good plan. Do we have Mike, do you have a question?
Yes, and I apologize if I'm getting too far ahead of myself, and this might be a question more for Mason than Kelly, but, you know, with all the different maintenance things in there, and then getting at some point, hopefully, pray to God, we actually get into the new council on aging. So would a lot of these maintenance things go away? 'Cause I don't know the whole story and everything that's done, but I guess I'm just looking for a little hope. It's something to hang my hat on, and just hope that little shine of light that maybe some of these maintenance costs can go away with the new council on aging, because it's being taken care of by, you know, the agreement that could be in place.
Yeah, so I think from the operating budget perspective for the COA, I think the long-term expectation is yes, that those costs will a lot of those will sort of fall out of our direct responsibility. But this is still a city asset, the Larson Center. So, you know, until a decision is made on how to move forward with that, whether it's repurposed for other departmental uses or other uses, that there are still going to be, you know, costs of maintaining that asset. I think it maybe not being as occupied of an asset or as utilized, that could definitely reduce some of those costs. But, you know, it's still an asset that will be on the city's books.
I got 2 words for you: parking garage. Thank you.
All right, Kelly, thanks so much.
Thank you.
Keep up the great work. It's good to see you as always.
Have a good evening.
Yep,
I just have a question.
you're not off the hook yet. Almost.
With the, I don't know if, and I'm gonna have to check, but the expenditures, allowable expenditures from the revolving fund are for council on aging activities, printing, postage, for the newsletter and activities. When the ordinance was drafted, there was no salary, even a portion of it, contemplated coming out of here. We may need to revisit the ordinance through the council to update that, even if it's part-time, for the part-time nutrition coordinator to come out of there.
Yeah, I mean, our perspective on when we had read the language, we thought it clearly supported the activities.
I don't know.
But if
I'm
that's
you
not
know, I think
comprehended,
that
I
it
think-
warrants a discussion, but a heads up to the council. I wrote the ordinance, so I know I never considered salaries coming out of here. It wasn't the intention.
Okay.
So,
The language is pretty broad there, so maybe
I-
that's needs to be clarified, but from an
Um,
outsider looking in, I think the language is pretty broad.
yeah, because I don't know that the salary of a, part-time salary of the nutrition coordinator, I think we need to look. And so if that comes downstairs to you guys in short order, you would at least have the heads up and not like, how come nobody said that when the budget hearing went on? I think that was the only thing. Most of the questions that I had, I think Kelly touched on, and I didn't notice that before, otherwise I would have talked to you ahead of today, but that's neither here nor there. Thank you.
Kelly, thank you.
Thank you.
Thank you.
All right, we will now have Julie Hobson, the city assessor. Again, this is on page 57 in your budget books.
I think it's 47.
47?
Yeah.
HR, yeah, sorry about that.
Yeah, 47.
Yeah, it says 47 in the,
Yeah, I'd say we'll go.
yeah, let's be better. Let's be better. Julie, how are you?
Hi, good evening, counselors. How's everybody?
Better now that I'm on 47 and not 57, life's great. So it's just gonna be, as we've done in the past, just kind of tell us a little bit about your budget, what you're looking at, what you're thinking, and anything you think we should know.
Okay, sure. Our budget, once again, is level funded except for contractual increases. Those increases are basically in our GIS services, which are online maps, CAMA software, that's our computer-assisted mass appraisal software that we use for valuation. That contract went up. And for subscriptions, that's our CoStar subscription, which provides information analytics for commercial properties. That's really it. Our salary line is again, level funded. We did hire a deputy who is expected to begin on June 22nd, which is great news for the office. So we can hit the ground running July 1st, and yeah, that's it.
Yeah, it's, like you said, it's every year it's level funded, it's, not a ton of expenditures. Do we have any questions for Mr. Waterman?
I hope I'm accurate. Can you share with us, because you're losing one employee, correct?
No, not.
I'm wrong about that?
Right, so I was down the deputy, which I have filled for June 22nd. I do have another employee that is leaving the office, going to a different office. But I am expecting to be able to fill that position in short order with one of the employees that would have otherwise been let go at the end of the fiscal year. So
Okay.
I will be made whole, thank goodness, and
Okay.
we should be in good
I
shape.
just wanted to clarify that.
Thank
Okay,
you.
thank you.
Deb, anything?
The only question I have is on reval services. So first of all, I appreciate that we put it in the correct account number this year. That's been a longstanding problem on the accounting side, so I'm grateful that we were able to fix that this year, Mason. I know that there's been a recent practice that we fund the needs of the assessor for the outside reval services annually by appropriation.
It's the appraisal services. for
Appraisal
personal
services,
property.
like, but they're sort of,
It is annual at this
right?
point. The
I'm
reality
wondering
is.
why, is it just budget constraints? Was it this year's the full tape and measure? Like, that there was no ask and no modification, but sort of like as a general rule, it's now a standard annual expense, not extraordinary, not unforeseen, really not one time. I just kind of want to,
Yeah, I mean, to be honest, it's budget constraints, and I think because for a number of years the practice has been that. I think even from Julie's perspective, walking into the department budgets, that was just kind of the expectation. So although like there wasn't a formal ask in her requested budget, it was still discussed. It just didn't come in terms of actually being put in the request, because that was sort of an initial discussion even before those meetings started. But just given the financial constraints, yeah, it's just something that we'll look to fund, mid-year. Continue to do that. The number fluctuates a little bit year to year, but again, it's
I wouldn't
it's annual
expect
at
it
this
to be
point.
as high as the budgeted number in fiscal '26 of 145,000, because this is a full tape and measure year.
Right.
Correct.
And just because we're here and we have the opportunity, can you give us the 10,000-foot view of what that means to the community and the timetable for the tax recap?
So a full certification and revaluation means we're out there inspecting more properties, getting caught up on some cyclicals, and it's just a deeper dive into all of the information. The Department of Revenue takes a look at all of our tables, our land tables. They review everything, it does put things out a little bit. We are in very good shape. We started early this year. We're expecting to go into DOR review at the end of August, and we should be on normal schedule. Things shouldn't be held up. I know in some years, recertification years, we wouldn't be able to set the tax rate until late November, sometimes in December, but we're in good shape. It's more work. There will be a public disclosure period probably at the beginning of September, where we post the values and people have a right to come forward and question their value. Like I said, that's at the beginning of September. So it's a deeper dive. It's a lot more work, but we're in good shape for it.
Thank you.
Any other questions for the city assessor? No? All right. Julie, thanks as always.
Thank you very much.
Good to see you.
Thank you. Have a good night.
All right. Don't have Glenn. So we got the library. We'll go right to the library if Lynn's not here. You want to just jump to the library? Sure. Amy, you ready? Do you want to come on up?
I am, and
Oh.
board president is right here, so.
Look at that, perfect timing. Come on up. All right.
Cheerleaders.
Public library is confirmed to be on page 123. Page 123.
I saw how fast you guys moved yesterday, so I'm like, I'm gonna get down here.
Well, you know, you guys are all efficient with your budgets, and so it's great. So, Amy, welcome. It's good to see you.
Thank you.
So, yeah, just what we're doing is just kind of talking, anything you think the council needs to know about your budget and anything about the library you'd like to share. So, the floor is yours.
At the department head meeting we had last week, I was talking with my colleague saying my goal for this year's budget hearing is not to say this sucks on TV in the council chambers, but Kelly said it before I did.
So now you get creative.
So, yeah, I mean, I feel for you guys, listening to department heads, listening to Mason, saying this is really hard and we're doing the best that we can. We did get staff cuts, and we are struggling with that as a team. We, as you know, take pride in our work, and we have made great strides in the last few years to work with a number of city departments doing programming, opening up our space for meetings. As Kelly mentioned, Kelly, Christy, someone from the zoo, and Kaylin get together once a month to talk about programming in the city and how we can best serve the residents and how we can make the best use of our resources. That's hard. Now we're all struggling. I'm going to be at the desk. You'll see me at the desk more often. My assistant director will be at the desk more often. All of the full-timers who do programming will be at the desk more often. That being said, we are known for excellent customer service. When HR did a training on customer service for the city, there were a lot of jokes when I walked in saying, "You're teaching this?" Like, that's the environment that the library has in the downtown, and we extend it to City Hall, and so yeah, I'm really proud of that, and I'm really want folks to know that is a team effort. Like, all 24 of our folks work really hard to make sure we do the best with what we've got, and so again, like Kelly said, team players.
You also deal with a lot of unforeseen and different challenges from some of the members of the public that come in, especially in the colder and warmer weather.
It's wild. Kudos to Jessica Spence. Having her in the building the days that she is there is phenomenal. Not only does she help the patrons that need her specific services, she helps the staff. I'm gonna say train staff, but she just kind of reassures them that what they're doing is sort of the right thing to do or the best thing to do. We had a rough day about a month ago where quite literally police or fire was called 3 times in one day before lunch. That sort of thing, like that takes days for staff to recover from. Like the people who are in the building, the people who hear about it afterwards. You know, and then she walked into my office and said, "How are you doing, Amy?" And it was like this crazy moment where like nobody ever asks me that. I'm calming everybody else down. But it's good stuff. Like that's what we do. And sometimes it seems like library is a nice to have thing, but we truly feel like it is a need to have thing in the city. Some of the services that we provide aren't anywhere else, and they aren't available as many hours as our building, the doors are open.
Thank you.
It's my library soapbox.
It's a great soapbox, and it's a soapbox that's
Yes.
well-run and that I know a lot of people take great pride in. Anything else you want to talk specifically, budget, increases, decreases?
We took our hits. If anything goes wrong in the building, you'll hear from us. As you know, the city budget isn't our only source of funds. We do have state aid that we have put aside for, we've got some HVAC things happening now. We're working on those that we can fund with state aid money. We're using trust money to fund a lot of our collection. You know, we're required to spend 13% of the total of the budget on collection items, so there's a line item that actually was increased a little bit this year. And we combine that with state aid money and board money to fulfill those requirements.
Deb, do you have any questions?
Not really, other than any impact due to the cut. I don't think so, because your budget still went up, but anything on the numbers as it relates to your state aid? Will there be a corresponding cut? Did you guys already look at
Still
that?
within the,
Yeah, it's
still in
within-
the same range. So
So you're
we're,
okay?
so we're going from 56 hours to 53 hours. That's in the same range. If you're above 56, you have to meet certain requirements, and we haven't been, or if you have 60 hours is the maximum, right? Is
Yep.
to get the 100%. We're at the 93% level.
Mhm.
I think we've been at that for
Yeah.
decades.
So the percentage is consistent?
Consistent.
Yes.
Consistently below,
Correct.
but consistent?
Yes.
Correct.
Okay.
But that's the biggest thing. I know it's clear in the book, but the biggest thing is, you know, the reduction is to go to summer, so what is known as summer hours year round. So the biggest change here is you know the reduction from the 56 hours a week to 53 hours a week, which is I believe May through. Is it
It's June through August.
June through August. Sorry.
We're half-day Saturdays, and so we'll have half-day Saturdays all year in FY27.
That's how you're addressing the reduction in staff?
In hours. And then how we're addressing the reduction in staff is we had one 22-hour position, so a benefited but part-time position, the only one in the city. And that person was able to work the circulation desk and the children's room desk. So it's tiered who can work which desks. So they could work 2 desks, and they only worked nights and weekends, which is a hard position to fill. But so we reduced that. So that position is gone, and then that person bumped down to a desk assistant because we did have one person resign just recently. And so the only person who's leaving the team is leaving to spend more time with her grandbaby.
Do we have any additional questions for Amy? Mr. Waterman?
I'm going to be a little hazy with this. I was under the assumption that we were at base level in terms of, in order to be part of interlibrary groups that we belong to. Does this affect that at all?
No.
Thank you.
So we're part of the sales network, and we pay dues to be a part of that. Then that gets delivery and interlibrary loan and all of that.
Okay,
Yep.
that's good.
Thank you.
You're welcome.
Kudos to you and your staff. I know you put up with a lot more than people realize, I think. And kudos to you and to the Friends and, you know, your board. You guys do a great job.
We do a good job. I welcome you all to come by and tell the staff that you think they're doing a good job. They could use that right now.
Sounds good.
Till next time. Thank you, guys.
Thank you.
Thanks, Amy. All right, we will now go on to human resources, and Lynn is here. Lynn, good afternoon. I almost said good morning at 6:15 at night. Confirms.
I'm done with the morning today. Can we?
Yeah, tell me about it. Page 59. Good to see you as always.
You as well, Councilor Delesio?
So if you just want to kind of talk about your budget, how it's set up, any changes, any increases, decreases, anything you think we need to know while deliberating, that'd be great.
Sure. So I think as you can see, we are down a staff member. Same story as a lot of people, we're just not filling one of the positions. We do have some reductions to the safety and staff development lines, which we've done a lot in the last few years, so I think we're gonna make this work. We have done a lot of training, not that it's not always important, but I think it's appropriate this year to scale it back a little bit based on what we've done. A couple of the wild cards before I get to the big thing, which is health insurance. Workers' comp, it's not an exact science. You'll see that there was an increase. If we have injuries, it's gonna go up. There's nothing we can do. We can't predict that. So we base our numbers on the trends that have been in the past. We cross our fingers that no one gets hurt and everyone stays healthy, but unfortunately things happen. So we're budgeting for best case scenario and what the trends have been. But you know, as we all know, if things happen, that's when we come back and ask for more money. And we did have to do that this year, unfortunately, for a few of the things that did happen. The biggest thing that we have, obviously, is health insurance. I say this every year, and I say it at all the IAC meetings. Health insurance is broken. We didn't break it, but we have to deal with it. And it is one of the biggest challenges that we face. We do what we can to try to keep costs low. Some of the stuff we just can't control. So what we did do this year is we did add a high deductible health plan, and we added a health savings account. We did that late in the game, so we didn't get a lot of participation for this open enrollment, but hoping to educate more people and get more people on board next year. Unfortunately, every year is the same in every place. We can't get the rates until a certain period of time, so usually around February is when we start being able to look at the rates, because that's when the claims from December are in. And then the consultant analyzes them and then gives us some feedback. So it's always a crunch at the end, because open enrollment is the first 2 weeks of April, and we do that because of the school, of how the school pay works. And it's like that in a lot of communities, so we're always under the gun. So we were able to get the high deductible health plan. It'll be in place for July 1. We did have some people take that option. Again, hoping to educate more over the course of the next year as one option. In addition to that, we were able to get a contract for a pharmacy benefit consultant, something that's fairly new. These consultants will go out. A large portion of our money is spent on prescription drugs. So these people go out and they try to negotiate better deals, either with our current provider or with other providers. We would try to make sure that any deals that we did do would have really no impact that the members would see, so our employees would see. So it might be something in the background that we're doing, but our employees aren't gonna see it. So they're in the process right now of seeing what they can get into place for July 1. Again, short timeline, we just kind of signed it, you know, doing all this at the same time. Hopefully we get something, right? Every dollar counts at this point, so we're hoping that by July 1st of this year, we have some form of savings in place. Again, fingers crossed, we're still kind of waiting to hear on that. Just want to make sure I'm covering everything, because I know there's a lot. The next thing that we really need to do is make plan design changes. We do not have a choice. There's no other way to realize any additional savings other than plan design changes and contribution changes. So we, Mason and I, have been discussing this with the IAC probably since we've both been here. But it's not something that you can do in an instant. It takes time. So we have educated the IAC over time as to what has been going on, what the trends are, what it looks like everywhere else. They've seen the increases, they've been part of it. Our consultant comes in and talks to them, kind of like the consultant came in and talked to you all as well, to let them know what's going on and why we're seeing these increases. So everyone is aware that we need to do something. The next piece is what do we do? And we absolutely, and we've told them, in this next fiscal year, we have to make this change. There's no two ways about it. So what we have started to do now is we're gonna meet with the union leadership, their council if they so choose, or their union reps. Mason and I will meet with each individually to kind of gauge where they're at. I've told everyone, you have to play ball. There's no other way to do it. So we're hopeful that we can sit down and try to gauge what their involvement will be. And if they choose to do that, it could be a lot easier, and we can do it via negotiation, via 150E, and come to some form of an agreement. If we discover that we can't do that, we will be seeking your help. And as the consultant came in and explained, there is a way under Mass General Law, Chapter 32B, Sections 21 to 23. If you were to adopt that, that gives us some options to, I don't want to say force is the wrong word, but be able to make some changes to the insurance without doing the negotiation process. There are some limitations to that as well. I'm not going to tell you it's going to be easy, but that is the other option. So Mason and I right now are endeavoring to set up meetings with everyone and to kind of gauge, and then we will be able to hopefully report back to you all and let you know what direction we're going to be in. Either direction is not going to be short. It's not going to be easy. At the end of the day, is there going to be some cost shifting? There is, and that's what every municipality is facing right now, is some cost shifting, unfortunately. We do the best we can to try to mitigate that. I think a lot of it has to do with education. Not a lot of people are good healthcare consumers. And that's what I say in the IAC meetings. Healthcare is no different than anything else you buy, whether it's car insurance, life insurance, any other product that you buy. You have to know what you're buying. You have to know what coverage you have. Ask questions. Make sure the billing is correct. Don't accept that what the hospital is telling you, is what you owe. Ask the questions. People sometimes are afraid in healthcare to do that. So we're really trying to push people to look at their explanation of benefits better, have a better understanding. If you don't and you need help, come to us. Call Blue Cross. We'll direct you where to go. But to try to be better consumers, that makes it better for everyone. But it's not easy because it is complicated and people do get flustered. So we're really trying to explain to people, this is the coverage you have. These are the questions to ask. People are afraid of deductibles. This year, I think we really got through to a lot of people. The deductible isn't necessarily scary, but what you need to know is what your family's needs are. Not everything hits the deductible. Sometimes it's just certain services. Obviously, you can't plan for an accident or things like that. But some of the deductible for families that are fairly healthy and you're just using the wellness visits or occasional visit here and there, you'll never touch the deductible. People don't always understand that. The deductible is scary to people because they just think of this, I have to pay this $500 up front or $1,000, whatever it happens to be. That is not the case. It's really about learning about the coverage and learning about what you do need to pay out of pocket and ways to mitigate that, right? We have a flex spending account. Trying to educate people. Put money in there. It's pre-tax money. Put it in there. You can use it. What part do you need to use? What part don't you? What's coming up in the next year? Someone's having a hip replacement. That's something you're planning ahead for, right? You can put more flex money in this year to cover that deductible if you're doing that. There are definitely ways to do it, and we've really been trying over the course of the last few years to drive that home. I think this year, introducing the high deductible plan, people really started to pay attention because they started to pay attention to their rates. And the more that the rates go up, that's when people really do start paying attention. So we've really been trying to hit people with that, as many as we can. We've done a lot of sessions. We deal with a lot of people at the IAC, but it's only a small population. So we're really trying to reach out and get in front of more people to educate them about the deductible plan, because at the end of the day, the deductible plan is cheaper. And there's reasons for that.
A lot more people are taking it this year than last
Right.
year, so we're starting to see that.
We're seeing the results of our education pieces, because even if they're not on the high deductible, people are now testing the waters with the $500 deductible, which they were not in the past. Everyone was just in the straight HMO. So some of this we are seeing results from. Something that takes time, but I think if they're ready to dip their toe in the 500, some people are ready to dip their toe in the high deductible because it's not really that high. But they are ready to start to go in that direction, especially when people understand the health savings account is yours. You take it with you. The money is in your account. I mean, obviously, if you don't withdraw it for medical reasons, you pay taxes on it. But if you do use it for that, the money remains yours and it grows. It's an investment account. So people who are maybe later in their careers may not want to get into this. People who are younger in their careers, this is like another retirement account for you. Because the city's putting 50% of the deductible in. Because even with that, with the high deductible plan, the city saves money. So we did the numbers, we knew what it was. And even with the city's contribution of that 50% deductible, we're still going to save money. So people are starting to, I think, pay attention. People are starting to really want to listen and understand the plans. And that's really the direction that we need to go in. And it's not an easy one, and it's not pretty. And, health insurance is a sensitive subject. It's a big benefit that a lot of municipalities offer, but it's also one that's costing a lot of money. So we're really trying to work hard for some cost-saving measures to get there.
Vice President Dolan.
Thank you. So what is the deductible on the high deductible plan?
It's $4,000 for a family and $2,000 for an individual.
So may I follow up? So are we, are you all concerned at all about like retaining talent by changing these healthcare plans?
No, I'm not. I'm really not. If you look at the packages that other municipalities are offering, we're very comparable. We're
Well, offering now, but in the future.
even with some of the changes that we're going to make, I'm not concerned about that.
Because 4K and 2K is still a lot for a family, that if they have an
Right, and that's it, but
issue.
that's a high deductible option, right? So we still have a no deductible plan, we have a deductible plan.
Oh, yeah, I realize that, yeah. So there'll be tiers of plans.
Correct,
I
yeah.
get that.
Right. Keep in mind that the city's putting in 50% of that on July 1st.
Yeah.
So if you're a family, you're covering that $2,000, and you can do that the same way through. If you have flex spending, you do the same thing with a high deduct the HSA. You can put it in weekly, or you can make a contribution to it. Again, you'll get credit for any taxes because it's pre-tax money, but you can do that as well. So there are different ways to do it. It's not, you can have that money in there to cover it right away. You can put it in gradually. Some people, you're going to put that $2,000 in. They're going to have that $2,000 next July 1 when they re-sign up for it, because they're not going to have hit the deductible. It's about understanding the plan and what things are going to hit the plan.
And I get that. Sorry.
No, you're fine.
We have an HSA, and, before my husband started working here, we had an HSA, and we use it. So we have, and it's not just like, if you lose a limb or something, glasses, eye appointments,
Yes.
dentist appointments, fillings, crowns, and it's amazing how much you actually spend throughout the year and suck up that entire HSA. So, I'm definitely concerned about, people want to work for municipalities, right? And we struggle, like in water and wastewater, we're struggling to find people that are qualified for these jobs or even want to do these jobs. And I know that there's a big attraction for any municipality, not just ours, because of the benefits. So, when you talk about negotiating with the unions and, using Chapter 32B, I don't know. It's all concerning, and I know that you didn't break it, that we didn't break it, the city didn't break it. But it's concerning. It's really concerning because lack of good coverage can really hurt a family a lot.
So I would say health insurance isn't our only benefit. There's a lot of other benefits to working to a municipality, right? 14 paid holidays,
Of
sick and
course, yeah.
vacation. So it's not just the health insurance. Is that one thing? Yes, of course it is. Is it a big thing? Yes. I wouldn't say we're having a lack of coverage. Our coverage is still very good. Yes, there's a deductible, and certain things are going to hit the deductible, but I wouldn't go to say, personally, in the past, my husband and I were both self-employed, so I've been in a high deductible. I know what that looks like. I know, a lot of the things that at the time that did it, we had a $10,000 deductible. So I understand that, but that isn't what we're facing. Right. That isn't what we're looking at here. Our coverage is still very good for what we have, and we will continue to make sure that, we do the best we can, but we're also very competitive. a lot of the issues in water and wastewater is not the benefits, it's shift work. And that's where everyone is struggling, is with the shift work. Veolia, who's a private contractor, they're struggling to have operators in wastewater for that reason. A lot of it is shift work. Everyone wants Monday through Friday days. These facilities are 24/7, 365, and a lot of people don't want that. So I wouldn't say that the issues that we have in water and wastewater are related to benefits.
May I? It was just an example.
No, I understood.
It was just an example of retaining talent, because people are drawn to municipality work because of the benefits. And it's not just the insurance, it's the days off, it's everything that we all have to offer. And my company's deductible is $10,000. So I basically got to lose a limb or, have open heart surgery to even meet that. That's with, deductibles and everything else, that they only cover 20% of this and blah, 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 So, like you said, education is key. Calling Blue Cross Blue Shield or anybody else isn't necessarily successful, because they really beat you down until you give up and just cry on the other end of the line. But
being self-insured, our employees do have another option, because they can come to our office, right? We do have some control over that. Blue Cross is our agent; they're administrating it, but we're the ones paying the claim, so we're driving the bus. So our employees do have an option. All of our health insurance plan designs are online, so I'd encourage you to look at them if you're curious as to what it covers and what it doesn't. And I do understand it does get frustrating, but letting them win doesn't help, right? And that's part of my point about being a good healthcare consumer, is understanding the plans, really diving in, and that's really what I've tried to do, is have people, because you can tell right from the explanation of benefit, right, whether or not the doctor's office is charging you the right amount. If the EOB from Blue Cross says you owe $40 and you get a bill for $80, I'm not paying the $80 bill. I'll pay the $40 bill, and I'm going to call them and tell them why.
Right.
It's, again, do you have to be an advocate for yourself? But I say yes, but you have to do that in everything that we do. People tend not to do it in health insurance, because they tend just to believe whatever the office or hospital or whatever is telling them without questioning it. And that to me has always been the problem. I mean, my prior background, I negotiated bills all the time. Hospitals write stuff off all the time, right? There's always, if you're paying them, there's always something to talk about. Not everyone wants to do that, and I understand it's time consuming, but it's the only way we're going to be able to combat some of this with health insurance. It's going to take us to do it, right? All of us as consumers, not just the city of Attleboro, but everywhere, to really push back and say, I'm not going to just take this from you anymore. You're going to have to tell me why I owe you this, or explain it to me. I know it's hard and it's a lot, but it's not just here, and it's not just Blue Cross, and it's everywhere, and it's every provider, and it's tough for them too. Like a lot of people don't want to be primary care physicians anymore, right? Because of the BS, people are having tough time finding one. But we have an HMO, so we have to, because the HMO is cheaper, right? It's a lot of things, and we've tried to make some connections at Sturdy, and they've been good about helping some of our people find primary cares when they can't. So we're trying to mitigate some of those, so people aren't saying, that's it, I'm just going to go to the PPO. That's the more expensive plan, and the coverage is the same. You just don't need referrals. And if you're not someone that needs a referral all the time, or you might want to think about it. Again, there are all different ways to do it. The high deductible is not for everyone. I'm not going to tell you that it is. But I think if you understand the needs of your family and what the coverage is, you can make better informed decisions about what plan that you need.
Thanks.
Thank you. I've got a couple comments, and we'll go to Mike and then John. Were you going to say something?
Well, I was just going to say, I think, Vice President Dolan, we share your concerns about retention. Because I get exactly what you're saying. I will say, compared to surrounding communities, a lot of communities have gone to 70-30 on the split, 72-27. Like we're at the peak end. There's not really communities above 75-25. So we're very rich in that respect, in contributing 75% of the plan cost. So in that aspect, we think we'll still be competitive, but I think the bigger concern for us is not just retention of existing employees. Like the reality is if you look at the health insurance budget right here, even with staffing cuts, this is just in this department, not excluding the school department, excluding water and wastewater, it's $1.5 million increase in 1 year. It was bigger last year. Last year was 15%.
Yeah, I mean, it's horrifying, and I'm certainly not blaming you guys.
Right.
So I just want to.
But with that, our bigger concern is, yes, retention, but if we continue on this path, we're talking about departments that are going away. Like the city will no longer be able to have every department and every operation that it has if our benefits continue to crawl out, just carve out the budget. And that's exactly what's happening here. So when we talk about retention, we want to be able to retain our employees. So we have to kind of unfortunately spread the pain of this throughout the city. Otherwise, we're quite literally going to be reducing departments. It's that severe.
Yeah.
Yeah.
So, Mike, I'm going to recognize Jonathan as a member of the committee, then I'll recognize you next, okay? Jonathan?
Well, first of all, I just wanted to give a plug for HSAs. As someone who does not qualify for an HSA, I am envious of people who can, because that is a huge benefit. I mean, the fact that you've got that triple tax play there, like money goes in tax-free, it grows tax-free, you can take it out tax-free, that's incredible. But, so people should take advantage of that for sure. But my question was revolving the point that you just touched on, Lynn, which was on negotiating bills, right? So as someone who hasn't had traditional insurance for over 12 years, I'm part of a healthcare sharing ministry. One of the things that's super important is that you keep the costs in check, and healthcare is one of those weird industries, right, where it's very difficult to get a solid number on what services cost, right? I mean, I walk into the grocery store, there's a number right there, right? I want, I don't buy a jug of milk, it's, $2.50 or whatever it is, right? Healthcare is so convoluted. I'm curious, you mentioned, of course, for folks to kind of push back when they get bills from hospitals or other medical providers, because it is scary, right? Are there consultants or are there other avenues for people to seek resources, city employees, to be able to help navigate that, know what questions to ask? Because like you said, it could be a matter of thousands of dollars, quite literally, in a lot of cases, and sometimes it's just a phone call. And a short conversation with someone to sort of navigate those things, and I understand people also need the incentive to do that. But are there avenues other than if someone comes to you, right, and asks the question, something that someone could maybe more easily get that sort of consultation? I mean, I don't know if there's third parties out there that provide those sorts of services to help negotiate those bills. I guess that's where I'm going.
I don't know if there are services. I mean, we have an EAP program, an employee assistance program, that they can certainly get some advice from. I think a lot of it, AI and ChatGPT, right? You can ask a lot of these questions and at least get some baseline of understanding. Like, I always use, what does an MRI cost, right? Like, what it costs and what we pay are two different things, right? Like, whatever the cost used to be, dating myself, but back when I did personal injury work, it was $1,800, right? But the insurance bill would be $700, right? And if they didn't have insurance, sometimes we pay $500, right? It's a phone call. So I don't know if there are resources, but what I'm really trying to stress is that when we do these sessions, people come and try to understand for themselves what the insurance covers, what the explanation of benefits looks like, and what questions to ask. So while you might not have all the answers, I want them to understand what the process and what they're looking for and where to go. Some people say, I don't get my EOBs. If you sign up for My Blue, they're all in there. You can get them all. A lot of stuff isn't mailed anymore, right? Like, obviously. So if you sign up for the My Blue app, you can go in either online or on the app, and your explanation of benefits is there so you can look at it. Again, it's about being a good consumer. So part of the teaching points for me are, what's your bill say? What's your EOB say? What is an EOB? Like sometimes, I'll use that term, explanation of benefits. What does that look like and what does it say? How to read it so that they understand that they can go back and have that conversation. So it's arming them with the process, and instead of, you don't need to know how much an MRI costs. You can put it into ChatGPT and find out, but it's how much your coverage is and how much you have to pay out of pocket. And that's what we're trying to arm them with. What hits the deductible, what doesn't hit the deductible? What's in urgent care? That becomes an issue. Some places will bill urgent care as emergency room. And so you have to ask them, are you gonna bill me as an ER? Because your deductible may be different, your copay may be different. It happened to me when we were in, my son was in Connecticut at a lacrosse game, we had to go to urgent care, and they billed us as an emergency room. I said, you held yourself out as an urgent care, so I will pay you the urgent care rate. That's that. again, this is something I did in my past life, so I'm comfortable doing it, but I'm also comfortable telling people how to do it. And that's what we're really trying to drive home with the consumers, with our employees, is come to these sessions, ask the questions, let's help you understand. And if not, call us and we'll give you a little bit of a script, right, when you call Blue Cross. And if they can't get it done, we'll call and we'll help them.
Thank you.
So, Michael, before I get you, I'm sorry, but when we're talking an awful lot about, like, you know, consumer awareness and being educated consumers, which is really, really important, but what are we doing as a city to plan for this going forward? We know that this is coming forward, but to just kind of put it all on the employees' back and the consumers' back, right? So what are some of the things that we're doing? Because I share a lot of what Vice President Dolan is saying, but I also know that other municipalities, you know, we're not alone. I think another issue that we're seeing is some of these pharmaceuticals that are being used cosmetically is driving up the price, some of the weight loss drugs, you know. But, I mean, what can we do as a city to plan for this so we're not just putting it back on the backs of the city employees saying, be better consumers? Like, that's a huge part of it. It's important, but I don't know that that's going to be the answer. Like, what can we do as a municipality to plan? Because as I've said a million times on this floor is, if we fail to plan, we plan to fail. It just seems, you know, I know that Bill Lawson's been coming down for 2 years talking to us, like, costs aren't going down, costs aren't going down. What is it that we're doing? What is it that we can do to plan for this? As opposed to just saying we're gonna, in the cost shift, which is important. I think it's everyone, it's our insurance, we should pay more if that's the case, but what can we do to plan for this?
Be healthy,
No,
right?
you
At the
can't
end,
control
at the
that.
end of
You
that.
can't control
Well,
it.
you can, right? There is no fix for the cost of health insurance. There isn't. We're no longer covering any of the GLP-1s. Blue Cross did not cover them. We did not pick up a rider to cover them because it was gonna. If we covered them this year, our health increase would have been, as we projected, between 18 and 21%. So it is. I understand what you're saying. We're planning by trying to move the plans, right? The plan design. We don't really, I can't control what everyone else does, right? I can't control our population. I can't control our claims. It's driven by claims. That's what drives our premiums. I can't control any of that. We hired a
I'm not saying
pharmacy.
you're doing it, right? So I'm not putting this
No,
on you, right? So I understand, like, people can't control if they get, you know, we can try to be healthy all we want.
Correct.
Anything could happen.
But it's also not just planning, like, the HR department specifically has been putting on a lot of different opportunities, you know, to try to promote healthier activities, like the STEP programs you guys have been doing. Like, there's been a bunch of different actual efforts, and then even just within this budget, there's new line items in this budget, right? Because of adding the high deductible plan, like, we are trying to explore different options and provide different offerings to the employees to do that. Adding a pharmacy benefit consultant, they're actually going to go negotiate rates. Like, that was a big step forward. You know, meeting with consultants and then making that recommendation, that was initiated again by HR. Like, this is something that, you know, HR is tackling every single day because they're the ones processing the bills, so they're seeing this so they know how challenging it is. So these ideas are coming forward constantly. I mean, you talked about the Good Health Gateway. Like, there's just a number of programs that they brought on in the last couple of years that we're seeing results from, but the problem is so large in scale and it's growing so exponentially that, like, those small efforts, while long-term will help, they're not going to solve the cliff that's right in front of us.
Oh, sure, and this is certainly symptomatic of a bigger problem outside of Attleboro, outside of the
100%.
Commonwealth.
Yes.
Right?
100%.
We know that,
Yeah.
but I don't know. I don't know. I just can't, in good conscience, sit here and I know the hard work that you and your team do. My comments isn't about that. It's about what collectively can the council, can the administration do. You know, I don't know, just stabilization account of some sort, you know, and again, I know I'm just spitfiring, but is there something else we can do? Because I worry about the seniors, I worry about the veterans, I worry about everyone who's struggling with everyday living, let alone the cost of healthcare. Like, I understand, like, this budget, there's not a lot you can do. You're dealing with stuff that's outside of your control, and I get that. But how do we find some way to operate within that, navigate with those waters? And it's not anything we're gonna solve here tonight, probably not even in the next 2 or 3 fiscal years. That cliff is coming, and it's coming quick, and it's gonna bankrupt municipalities across this country. So I'm not okay just sitting there saying, well, we can try to plan for this or that. Like, it's gotta be a bigger ongoing discussion that the council, I think, needs to be part of.
Yeah, we agree, and I think at the end of the day, if our goal is to do this as collaboratively as possible with the unions, right? We want everyone on board. We want to work towards a long-term solution that everyone's on board with because we see the cliff coming. But at the end of the day, if we can't get to a place that we need to actually mitigate some of this serious wall that's coming straight towards us, then we will be coming to the council and asking for your support and asking for you to enact the authority that you can provide through adopting a state law to allow us to benchmark our plans to the GIC and to take some of these other options that will actually have significant overnight savings for the city and put us in a better position to not be reducing departments. But that's
Hopefully it
the
doesn't
last
get to
resort, right?
Because if it gets to that,
yeah.
I think we're looking at a lot of different other
We are.
problems that are gonna come
Yeah.
with that, so.
We are.
It's a tough situation. Michael?
Thanks, Councilor Delicio. Just a few, with all the talks, I had a few questions and most of them have been answered, but you'd mentioned earlier that people could look at for the insurance options online. Where can they find that?
On the HR webpage, I don't know if it's insurance plans or, I can't remember what it's called, but there's a menu to the left, and all of our plan designs are on there.
All right.
Is that it? Jonathan?
So one other question as I was thinking here, since we self-insure, right, and we're the ones paying out on these claims at the end of the day, is there a way to sort of reverse engineer maybe some of these efforts of, for example, keeping our employees healthier in the city, figuring out across all of the claims that are paid out, categorizing what those, whether it's just based on the bills or I'm not sure how that works, but the categories of certain things that we're paying out on to figure out, well, what portion of them are actually preventable versus catastrophic, like accidents, things that you can't do anything about, to sort of backtrack and figure out, like, hey, well, what percentage of these things can we actually make a dent in with more education and with more actual awareness around, hey, if, again, to Councilor Delicio's point, like you can do some of those things all you want. You can't prevent certain things, but by looking at the data of things that we can prevent, are there any meaningful numbers there that we can start to attack?
The number one issue that we have is diabetes.
Okay,
And
all
so we know that, right? So how it works is our consultant get claims feeds, right? So they know what the diagnosis categories are. Diabetes is the number one driver because they are sicker longer, they stay in the hospital longer, they take longer to recover, all of that, right? Which is why we have Good Health Gateway. It's a diabetes rewards program. Again, it's been a year or 2 years, 21?
Just over a year.
Just over a year. So we've had that plan in place for a little over a year. We are seeing benefits, but as Mason mentioned, it's not overnight, right? Yeah. It's a lot of education. People have to buy in. What do they get from that? They get free medication, supplies, testing kits. There's a lot of things. There are things they have to do. There was a lot of misinformation when it first came out about, well, I have to go to 5 different doctors and I have to get them all to sign this form. Nope, you can have all the doctors, one doctor sign the form. You don't have to go to every single doctor as long as they're doing a foot exam, an eye exam. There are certain benchmarks that they have to hit in order to be eligible for the program. And with that, they get a nutritionist, a nurse case manager, someone who calls them. They get things on the app, they get recipes. But diabetes is the number one driver, and that's why we bought into that plan. And we are seeing results, but again, it's been a year. So it's going to take time, but it is the number one driver.
No, sir.
Yeah, thank you.
Deb, anything?
So just, for a little historical perspective and or just general commentary and stuff. 30 years ago, I worked for a different municipality before I came here. I was 60-40 split there. We're 75-25 here. So as far as on a relative basis, I don't know what that community is today, but we're pretty close to like the 75-25, 60-40, you know what I mean? Like, so the idea that the shift is going to happen at some point, it's already been happening in other communities, just, point of reference. I don't know what all other communities are around us, but I have colleagues and friends in other communities, and that's not unusual for the shift to change. The best thing about us being self-insured as an employee is we do have a resource here, right? Like as an employee, that if you have somebody that has a catastrophic illness or you have something, you do actually have a place to go. So that's a great benefit to have in the city. We have a contact. I mean, as far as explanation of benefits, I'm one of those people that I don't think I've seen one since I had a surgery in 2015. I've yet to see an explanation of benefit. They don't send them anymore, and I don't look, but I'm not on a deductible plan, so I'm not the greatest consumer in the world as it comes to that. But, and one of the other things that as a municipal employee, that's a great benefit, right? I remember when, because we're a border community and I'm dating myself, but when Harvard Pilgrim Healthcare went under in this area years ago, I can remember how many people called because they were afraid that they weren't going to have coverage anyplace. Like, what am I going to do? You know, or the Uniteds, the Uniteds went away in the area and stuff like that. The HR department here, there was a place to call, and our retirees and our employees or the family members of those folks, they had a resource to go to, so you didn't have to worry so much. So that's a great benefit, being self-insured and having that here. But the cost of healthcare, we all know, it's just astronomical. And not tonight, because I don't think it's this particular department to have the conversation necessarily with, but the post-employment benefit piece of healthcare and the long-term impact to that to the taxpayer here is something that we need to have additional conversations on, right? Like, a lot of this conversation has centered on active employees, but a large portion of our health coverage relates to health insurance for our retirees, right? So those are important conversations. I don't know the last time when was the last time we benchmarked ourselves to the GIC to see where we are, right?
I don't know if we did. I think where some changes were made, they were minimal.
The
But I don't
last
think-
plan design changes were 2014, and they were small in scale, and before that, I think 2010. I mean, we haven't made really substantive changes. Really adding this high deductible plan is really the only change that's happened to our health insurance since 2014 in the city, which, you know, while the costs have ballooned and other communities have been changing things, in some cases they make changes every year. We haven't really made any changes, and it's so to the taxpayer, right? It's like we have a responsibility to also make changes and make an effort there before we go to the taxpayer and ask them to potentially pay more in taxes or make sacrifices to the services we offer. Like, we have a responsibility to make some substantive changes here first, at least in my opinion.
May I follow up?
Yeah, please.
So, Mason, please correct me if I'm wrong, because I could be wrong, but the 26 budget incorporated a health insurance holiday.
Correct.
The 27 does not.
The 27 does not. So the 26 budget, there was a 1-week premium holiday. That was, as you know, there was a 15% rate increase. A 1-week premium holiday equates to about a 2% savings. But what it does is, it provides the savings, in sort of a holiday. There was 1 week where employees didn't have to have a deduction out of their paycheck. There was also 1 week where the budget didn't have to make a contribution. So the actual trust fund picked up some of picked up that gap. The reason for not doing that this year is because, ultimately we were expecting to be at 20 to 21%, which is where the retiree rates landed. So that is that's what that was based off of. In January, that's what happened, and that was what we knew at the time. And that's where we would have been if not for the elimination of the GLP-1 coverage for weight loss. That's about where we would have been. So it was a real number we were facing. With the sort of realized savings, which again, 8.4% increase is not sustainable, but it felt like a win, just in the context. With that, we decided, even though we have a little bit of capacity in the health insurance trust fund, it doesn't make sense to do a premium holiday this year, because if we're going to look at comprehensive changes, we need to be able to provide the opportunity to the employees, when you talk about the impact to the employees, to mitigate some of that impact over the next few years as we look to make significant changes, right? If they're going to have sort of a reduction in benefits, can we use some of the balance in the trust to mitigate that impact over those years? So we didn't think this year was the appropriate time to do that, given the difference between last year, this year, and where we think we're headed. So the budget also had to pick up that premium holiday this year.
Yeah.
So
Yeah.
So, I think last week, maybe this week, I can't remember, but I don't see it in the current, I don't think the vote has taken place yet. There was an additional ask for health insurance, right?
Correct.
Between health insurance, so the 26 budget had a reduction basically in the budget because there was the premium holiday. And, you know, we're in May and the forecast, you don't have enough money to get through the fiscal 26 budget. You needed additional money for workers' comp.
Correct.
And you needed additional money for health insurance, regular line items. And do you think that, I don't think you had extraordinary increase in overall salary, individuals coming on board. Is it largely driven by qualifying events? You know, so for everybody, when the budget is set, it's a snapshot in time based on open enrollment figures on a particular day, right? So if you're an individual plan, it's budgeted at the individual qualifying event, you have a baby, you get married, so on and so forth, right? Like, all of a sudden you shift to a family plan. There's no changes that come down to the council on a quarterly basis or anything, right?
Right. So it was driven largely by qualifying events,
Yep.
but mostly the unanticipated increase in the medics rates. So what was budgeted in 26 was a 7.5% increase across the health insurance lines, a mid-year increase of 7.5%. The increase came in at 21%. So that has driven a lot of the change there. There were some internal transfers and then ultimately some backfill funding to because those costs came in so much higher. So that happened January 1, unanticipated, and I think we had said at the time during some of the quarterly updates that, well, look, we're probably gonna have to come back for some money there. There's also been other movement in health insurance, so we will likely come back to you for some funding to get us through the year. It ultimately, you know, we budget for when we have vacancies in positions that we are hiring for, we budget for some of those additional hires up front. But as people go through qualifying events, children, marriages, etc., the plan costs can go up because if someone goes from an individual to a family plan, like the cost that the city has to cover can go up. So that's something that always can change throughout the year, and that could happen in this 27 cycle as well. For the MedX rates this year, because the last 2 years, in 25 it was an 18% increase, in 26 it was a 21% increase, and in both years we were budgeted about a 7.5% mid-year increase, which historically before those years we were talking between 3 and 5, so it wasn't an unreasonable number. But because of what's happened the last couple of years, we are budgeting a 15% mid-year increase for those MedX rates for January 1. So if it comes in higher, you know, we'll be in a similar situation towards year end. If it comes in lower, we'll be in a little bit better of a situation. But what's also important to know is with those MedX rates, as people retire and potentially transition over to those plans, when we have a position that's backfilled, so you could have a retirement and then you hire someone, you have someone transition onto those plans, but then you also pick up a plan for the hire. So that's why you'll notice throughout budgets, you'll see those MedX lines actually increase even more so on a proportional basis than the active plans, just because you're kind of picking up additional people in that coverage while you're backfilling the active plans.
Aaron?
This is just more clarification. When it comes to the retirees, it's only those that aren't eligible for Medicare that are on our plans?
No, so I was going to clarify that because I
Yeah.
think sometimes people are confused by that. So anyone who retires who's under 65 will remain on like an active plan. We transition them because, you know, they're retirees, so it comes out of retirement, but they're still on the active plan, so the HMO, PPO, they remain on that until they turn 65. When they turn 65, they have to apply for Medicare, and then we provide a supplement in MedX. So they make that transition at 65. So a little bit different depending on the age of the retiree. And
We refer to it as retiree almost
Right.
just because it's easy because it's the majority, but it really we should be saying MedX and active plans, but
Right.
yeah, because there is some that kind of fall between based on the age group.
So what is this? What is the supplement that they get once they're on the Medicare?
MedX. So
Which
that
is-
it's a Blue Cross Blue Shield plan. So Medicare will cover.
So it's like a Part B or?
No, they have to pick up Part A and Part B.
Okay.
And Medicare covers 80%, and the MedX will cover the other 20%. That's how it works. So it's a true supplement to it, and we have a prescription drug rider as well. So they only pick up Part A and B. They never pick up Part D because we have the rider on the supplement.
Looked at.
Well, thank you for coming down. Certainly gave us a lot to think about. But yeah, we're doing good work up there, so.
Thank you.
Thank you.
Have a good night.
Mine?
And then they just leave you alone
All right.
to the slaughter, Mason. All right, we're gonna go to budget administration on page, is that 38?
38.
Oh, Nathan, as we've been doing right now.
So, as I think everybody on this body knows, budget administration consists of budget, MIS, which is effectively our IT department, our management information systems, purchasing, capital projects, and parking enforcement. So, what actually makes up a majority of the expenditures in the budget administration budget is actually our IT-related expenses. So, this year, we are facing a reduction in staff. We did have a long-term employee that had retired earlier this year, and we were fortunate enough to have had an internal promotion for someone who'd been kind of training for a while to be qualified for that position, is doing a great job. And ultimately the decision, given the financial constraints, was to forego filling our clerical staff position. It's it's gonna be a challenge. Unfortunately, this is kind of where we're at, and it's incumbent on department leadership to pick up a lot of this, and as well as the other staff, and we're all in this together, and we're gonna work hard and make sure it happens. That's about all we can do. So that is gonna pose a challenge. In general, if not for the increased IT spend, especially related to the changes related to cyber, you would have seen a decrease in this budget with the staffing reduction. But you will notice there's some increases here within the purchase of services line. Specifically, maintenance of software, relatively modest increase there, a few $1,000s. That's generally just the IT escalation costs from year to year for a number of our software services. Primarily, that is our accounting software, our enterprise solution through Tyler. You will see IT subscriptions. So this is an account that hasn't been funded before. We have, there's some new funding in there, and that is related to the additional new software as a result of the cyber incident that the city faced. So we've taken a lot of steps forward to upgrade our infrastructure and our security software, and there's a cost that comes with that. So a lot of that cost is borne in the 26 budget through the end of this calendar year, and this would be for the remainder of the fiscal year. So, I think it's reasonable to state to the council that, on an annual basis, I would expect about an additional, to do the right things and the things that we need to do, at least at this point in time, we're looking at least another $200,000 in recurring costs per year to really have the city in a secure position. And the reality is that spend is needed. The risk and potential loss to not have those systems in place is far greater than the annual cost of doing it the right way. I think the the cyber environment is rapidly changing, so it's not necessarily a fault of, definitely not a fault of staff. The staff does the best that they can do with what they've been provided, and I wouldn't say it's any fault of necessarily previous administrations or funding, or honestly, it's the environment's changing so fast that the response, you have to be nimble, and which is hard to do in a municipal environment. That's why municipalities are really a heavy target for cyber incidents, for cyber attacks. And even now, some of the leading software companies, now there's effectively AI alternatives to kind of infiltrate and test cyber security. So it's a rapidly changing environment, so it's important to make sure we're sort of as on the cutting edge as we can be, and that's what we're attempting to do here. Just to mitigate, any future risk and ensure that we continue to remain cyber insured, because the payoff there is significant. So that's a big part of what you see in the budget. The other biggest change, and really only change here, is in telephone. So that line was traditionally in citywide. So this covers, you know, these phone services which is effectively a utility, as well as the sort of the maintenance contracts on our phone systems in the city. That's historically been in citywide. The reason for moving it here is it's managed through MIS. It's always been managed through MIS. We manage the contract. We're the ones actually overseeing it. It poses a ton of challenges being out of citywide. So ultimately, this is a recommendation from the administration to actually house the contract under the department that it's actually managed by. You know, there might be some different perspectives on that, but I think it's the right thing. I think it's more transparent in what is actually being done here. It allows us to manage it better going forward.
So Mason, that doesn't, when you look at that 105,000 plus, so that's just for maintenance, servicing, does that include new equipment if we need new equipment?
No, so we did a major phone upgrade recently with ARPA funds, and so we have a good amount of attic stock. So this is actually a purchase of service lines, so this wouldn't be a supply purchase here. Those, you know, if we needed to, potentially that would be office supplies or network supplies, but actually we still have phone supplies in citywide. So this is really for the maintenance contract. And also the phones actually function more as a utility. So there's sort of two components to that with two vendors, and one of them is really like functions as a utility. So that's effectively what that 105 is. And it's really a one-to-one. There's a reduction in the citywide line and moving this over here.
I just thought it was an important clarification.
Yes.
Thank you.
And then I don't really have much else. Administratively, just making some small cuts. You know, I made some small cuts to our supply lines, you know, trying to live within the financial constraints that we have. You know, I think ultimately long term we'll look to make larger bulk purchases of computers and servers as more capital improvements. So, you know, the amount that's included in the budget is really for the smaller scale items that are needed throughout the year. But we look to make sort of bulk purchases every few years.
Any questions for Mason? Mr. McIntyre?
Thank you, Mason. As it relates to the kind of IT protections, cyber incident, very relevant. You said it yourself that that's an increasingly rapidly changing threat. As we look ahead to even future budgets, what's the chance that we're going to have to put even more money into this to keep the city protected against the threats? And I don't even want to know what AI is going to do to that. So what should we be looking at and anticipating in the future, far future?
Yeah, it's tough. I mean, I would say this will go up next year for sure in 28. That's because this is really only half the year of funding that's required for these softwares, because ultimately when we had to engage, you know, as a result of our incident, we're looking at sort of 12-month engagements there. So realistically, we're talking about the first 6 months of calendar year 27 is what's funded in this budget under IT subscriptions. Under the IT subscriptions. So that'll effectively probably be double next year. But it's hard with software, and especially with like the emergence of AI and how it's kind of changing the SaaS world. Over time, the actual marginal cost of software goes down traditionally. The marginal cost of technology actually decreases. Vendors in the SaaS world try to kind of have predictive pricing models and increase like 3 to 5% per year, but realistically their costs actually go down. So it's kind of tough. Usually it's sort of we traditionally have sort of gained processing power and like speeds at sort of the same cost. So like we might have kind of kept the budget consistent over time and gained kind of better speeds, better protections, better services, but sort of had the same vendors in place and kind of held relatively consistent. It's really hard to predict right now like where things are headed. We have a lot of services that are hosted on premises for a variety of reasons. And you know, it's a real question of like what is more secure, right? Is to have everything sort of off network, on network, hosted third party, cloud hosted. There's a lot of factors there. So that's where the pricing could really change. It's hard to say. If we shift from less like on premise hardware and more cloud hosted stuff, there's probably going to be more software spend and less infrastructure spend. But in general, I mean, yeah, I think you'll see an increase next year, and hopefully it will remain relatively stable. But it's hard to say.
Fingers crossed.
Yeah.
Thank you.
So if I can just, I had a very similar question, so thank you. I don't want to belabor the point, but what I would like to respectfully ask is, and maybe it's an executive session, but I'd like to get see an update from the administration to the council. Executive session might make sense, so we kind of know a little bit more about what this whole is,
Yeah.
this whole 107,000 is, and I know, I'm not asking you to speak on behalf, but I think it's important, so we know exactly what happened as much as we can. What do we do going forward? What does that look like? So we can be better prepared as well.
Yeah, absolutely. I mean, there's a number of things that are still sort of being dealt with under investigation and forensic analysis. Really, the softwares here are sort of, I feel like it's easy enough to speak on this with the software. I mean, these are really sort of, enhanced email security, threat detection and response, sort of like what you might know of as like a CrowdStrike softwares that are really critical, but a lot of things just don't have these, especially in municipalities. So these are softwares that realistically we should have been looking into, and we're starting to send our staff to cybersecurity conferences, and we're starting to look at these things, and there's a cost and there's an investment in those. And unfortunately, some of these things we're looking at rolling out, you can see it in my budget message last year about some of the cybersecurity stuff we were looking to do a year ago. Unfortunately, the time we were a little bit late on those things. So these were softwares and services that the city really needed to add, and that was sort of some of the first recommendations. But it's, big picture, it's email security, it's cloud hosted, effectively like Microsoft 365, moving to more of a cloud hosted model, MDR, EDR, so electronic detection and response, and then managed detection and response, and just, a number of sort of, threat detector softwares to just mitigate those things.
And don't get me wrong, I mean, it's 107,000 in an ordinary year. It's not a huge amount, right? But I think what you said earlier is pretty. Can't overlook what you said earlier about what the opportunity cost is if we have another cyber attack. And even what this previous situation could have been, which we still don't know fully what it is, but what could have been lost, what could have been. There's so many things that it could have been, so I think this is important, so thank you. Deb, anything?
No.
All right. So,
Just for the record, I'm all for the telephone being in budget and admin if that's who's responsible for it, so,
That's why I thought it made sense.
I mean,
I said people have various opinions, but
yeah. Well, I'd like to share mine.
I appreciate that.
We like that
I
stuff.
appreciate your support on that.
all right, Mason, thank you. So now we're gonna go back to Mason for city, page 34.
Can I change my mind?
No, Deb,
One
of
more.
course you can.
So, my office works particularly closely with procurement, obviously, right?
Yeah.
Because all the purchase orders that the city does, all the contracts, all of that stuff cross my desk, and I have to sign them. That Brooke is now doing because Carol has left. And we will work, my office will work with Mason's office to try to refine some of the processes. Some of it we're hoping to decentralize electronically and stuff, and use technology to enhance and make our process more efficient. But in the interim, until we're able to successfully implement all of those changes, we'll revert back to, trying to help out whenever we can as it relates to that, I mean, we did it for years, so we'll do it again, so.
And actually, if I may, I think Councilor McIntyre had asked about this. There are additional things that we're looking to do to deal with sort of, the personnel reductions. A lot of these, there's opportunities for efficiencies through software and technology. And there's a number of significant ones that we really need to make in the city and take steps forward on in the city, some of which require an upfront capital cost and will likely be coming down to the council relatively shortly for some of those, and the downstream effects are significant. I mean, we're talking about there's hours and hours and hours spent every week in the city to perform some of the tasks that we can have software and services do, and the return on that, especially in a moment when we're cutting personnel, it more than pays for itself. So we're looking to make those upfront investments for the sort of annual savings over time.
All right, we'll go on to citywide.
All right, so So citywide, I think the biggest thing, again, you'll see in sort of the purchase of services lines, top down is sort of the street lighting. So you've had funding requests actually before you. It's not reflected in the revised budget through April, but I think it's reflected in the year-to-date that I gave you today. So there was, additional funding needed for street lighting and some other various accounts, I think lights and power, some of these accounts. And so we're looking to adjust for those things. It may not be sufficient enough for what we need. This year was a little bit high. The costs were a little bit higher in some of these accounts, like heating this year. And it was a harsh winter. So, and we kind of know our natural gas rates now. We think actually the number that's submitted is probably a good number because this was such a cold year. But a lot of these increases you're seeing are increases from the FY26 original budget, but when you look at the FY26 revised, they're realistically not. Water service is, a response to kind of what we're seeing throughout the year right now. So we still have a quarter of billing left, and year to date we're at 140,000 expended. So we think the reason for that, obviously the rates have increased, but the other big factor is the last couple of years with these significant water restrictions, the usage from the city's perspective was also lower. So the budget didn't necessarily reflect a potential increased usage coming out of those restrictions. So the FY27 budget sort of reflects the usage in 26, which didn't have the same level of restrictions, and also the increased rates. Sewer is relatively similar justification. Are there any questions on kind of those top mainline ones before we move forward?
Doesn't seem to be.
Okay. So maintenance of software. So really what you're seeing here is a lot of these costs were covered out of, that we were just talking about for some of the IT costs were covered out of citywide. And so that's why you see a zero in 27, because we're picking up sort of the second half. And that's why I said it was about 200,000 is what you're seeing right there. So that's why that's a zero. That was sort of a new account in citywide. That's not a traditional citywide expense. Let's see. I think probably worth pointing out next. I mean, everything else relatively in purchase of services, relatively stable, relatively level. Again, telephone shifted out completely. That's why you see a zero in requested and proposed. So it was about 98,000 last year, about 105 this year after the upgrades that we've gone through. I think the biggest, the questions I anticipate would probably be on the reduction from the requested to the proposed in the insurance line. Which is still an increase from 26, but it is a reduction from what was anticipated. Those numbers are not necessarily finalized, but the reduction is based on what we know now, having brought on a new insurance broker. So the city had a long-time broker in the city. We went out and did a competitive process to have some different firms take a look at our insurance offerings, found a lot of glaring holes in our insurance. So as well as we found that we're a very marketable account, and we were significantly overpaying for really what the value of our account is. And from other brokers' perspectives, we are, a very top tier account. We were paying really what middle to low tiers were paying. So that's part of the effort to deal with that. So even in an environment where insurance is ballooning, we're expecting to see some good results in the market this year. And we also negotiated commissions reduced by third of what our previous broker was at. So it went from 15% down to 10%. So that was an activity undertaken by the administration to, again, we're trying to leave no stone unturned. So we're recognizing some upfront budget savings there on the general government side, as well as on the school side and water and wastewater. Hopefully those results even come in better, and that number might end up actually being it. This is effectively a budgeted 5% increase versus what was anticipated to be a 10% increase. The reserve fund for transfer, historically we've tried to maintain about 400,000 in that account. It's always kind of fluctuates because when new growth is certified and we true up the budget in the fall, that's really the location where we put the additional funding if there is some. So the last couple of years, we had kind of been reducing it. Again, this year, about 350,000. That's, you know, you had seen this year, we had a significant additional funds available in the reserve fund for transfer after new growth, but, you know, we are also, I think, down to, I have it in front of me. Apologize. I think we're down to 46,000 available in that reserve. So we're basically where we would expect to be towards year end, but any small items towards the last couple months could end up being free cash items because we've actually really depleted that reserve. So again, lower than what we'd like to see it at, but we think, you know, hopefully that'll be sufficient. I don't expect as big of a supplemental appropriation from excess new growth this year, just because, you know, the state aid number could be somewhat inflated in the budget because the Senate came in so much higher than the House, and usually they land somewhere in between. So that's a little bit concerning. That might eat into any sort of excess new growth we have from the conservative upfront number. Just something to consider. But again, we always submit based on the most updated numbers we have at the time, so weren't gonna make sort of an administrative decision around there, assuming what they would do up there. Hopefully the Senate holds strong. The House was at like 0.7% increase, and the Senate was over 5%. So hopefully the Senate comes through. But you know, that's just something to be aware of. And then reserve fund for labor negotiations. So this is primarily finalizing a negotiation year. So most of the union contracts expire July 1st. We have 2 unions that are on the city side that are currently settled for July 1, which leaves a number of unions still unsettled and still in negotiations. So this is pretty typical every 3rd year because contracts are traditionally not settled by the start of the year. Actually, I think this was the first year we had a contract pre-settled in a while because we had to kind of figure out what was the best way to tackle that. So this is pretty typical. We always have a reserve for labor negotiations based on, you know, where the city feels it needs to be able to settle negotiations and constructive and constructive contracts with our bargaining units. So I think if the council would like, you know, if it made sense to do an executive session for you to hear about, you know, the bargaining, the bargaining strategy from the administration, you know, we wouldn't want to hurt our bargaining position, but if that would make sense, that obviously would be welcome to coming down if that was ever something the council would like to do. Lynn and I are in all of the bargaining units across the city, so we are working with the school administration as well to work on those bargaining in those bargaining sessions with those unions. A little bit different structure over there because it is, you know, the school committee actually negotiates them directly, as like they have a few members from the committee that's on the negotiating team, so it's a very different environment. But it's been, you know, I think really good to be in the room for every single negotiation across the city and try to have sort of a consistent message, you know, shared efforts, make sure we're kind of trying to treat employees similarly across the board and kind of do it the best way. So we think we'll have some good results there. We've had success with a couple of unions already. And, you know, that's what we feel we will need to sort of allow for the increased costs within the budget once those contracts are settled. The reserve for capital is reduced this year from what we've kind of had as the capital improvements line of $500,000 for the past, I think, 5 or 6 fiscal years. But there's there's a direct reason for that. So ultimately, you see in the requested amount, the 701, what we had been planning in our forecast model for a while is to ensure that any debt capacity, and we talked about this actually last year because it was the same strategy in the FY26 budget, as debt capacity falls off, is to make sure that debt is held for capital expense. So as actual like debt expense in the budget comes off and fluctuates over time, to kind of make sure we hold that strong in the budget. And specifically this year, I mentioned it last night, but you know, we had just under 3.89 million in what I would call capital capacity in the FY26 budget. That included 1.82 million in general government non-excluded debt, 1.32 million in school debt, non-excluded, so not the high school project. And then 745,000 in capital funds between the police cruisers, the reserve for capital, and then the retrofitting of lights in citywide. So in 27, we have about 202,000 of non-excluded debt falling off. So in an effort to maintain that, we look at that third category of capital funds to kind of try to maintain that as best as possible. Because in 28 and 29, we'll have about another 500,000 debt coming back on. So if we kind of let that fall off and come out of the budget, it kind of conflates the budget issues we have. It makes it look like, you know, hey, really what happens is debt and capital falling off is paying for operating expense, which long-term is not a good strategy. It's why we have deferred maintenance, deferred capital expenses. Like, it's important that we have capital as part of our annual budget process and ensure that we are, you know, either using debt service or budgeted revenues to fund capital expense, because even though a lot of times they're one time, they're realistically recurring. We have, what, 38 buildings in city? That might be wrong. Number of buildings, number of departments, tons of facilities, so it's important that we have annual operating expense to maintain and upgrade capital. So the approach this year was to actually, rather than just go directly to the reserve for capital and have about that 700,000 reserve for capital, we focused on some of the urgent priority items in the CIP. And if you read the CIP in detail, you'll see that one of the things I worked with Gary to add this year was updating sort of the funding sources. So instead of just saying like city or state or grant, it actually says, you know, budget, free cash, debt service. Like, there was more specifics because that's actually a document that we use to kind of figure out, okay, where are we going? Is this going to be an item that we need to focus on for the budget? Is this a free cash item? Is this a capital stabilization item? Is this a debt item? So with that, we looked at some of the most urgent items, and actually you heard about some of them in the last couple of weeks with the two chiefs. So included in the budget is continuing the 240,000 for police cruisers, making sure we're continuing to plus up the fleet every year. 119,000 for police tasers. That's directly in the police budget in a capital line item. 50,000 for the active shooter gear, which is in the special safety equipment capital fund line item in the police budget. The HVAC improvements, which I believe are HQ and South Attleboro Station for the fire department, those have been urgent items in the CIP for a couple years, or they've been upgraded each year because they, from 3 to 2 to 1 to urgent, because it's really sat there for a while. And then the extrication equipment batteries, that's part of a 5-year plan to basically upgrade and make sure we get those new batteries. I think each year, I think it was 5 years, could be 3 years, but that was the chief's recommendation to kind of do it annually over the next few years, which is also an investment there. So in total, with the reserve fund for capital, it's 937,000, and that brings us, with the fall off of debt, but adding on that additional capital, that means we're having about 51,000 fall off in sort of capital capacity. So it's still, we are still allowing debt or operating expense to eat up some of our capacity for capital, and we're not necessarily growing our capital budget equivalently to our revenue growth, which is not a great long-term solution, but given the environment, it's sort of a compromise here of, we're going through operating reductions, staffing reductions. Some of these might have to be deferred to free cash, might have to defer some of these efforts to the fall. We're trying to knock out some of these things over the next month before the end of the fiscal year. So doing the best we can there. But the other thing behind that I think is helpful for us from a bond rating perspective is when we go into ratings, we can comfortably say that, look, yes, we used one-time revenues for the FY27 budget. We used free cash to balance our budget, but at the same time, it was an equivalent amount to the capital expense within our budget. So I think we can help mitigate some of the downside risk for using one-time revenues by being able to strategically say 937,000 in capital in the budget, and that was the amount that we used of one-time revenues to balance the budget. It's not necessarily moving in a positive direction, right? We're using one-time revenues to balance expenses that were in last year's budget, but it's at least I think, a way we can approach our ratings to protect against some of the downside risk in the environment that we're in. Sort of the approach there, and that's what I would say is basically citywide.
So, glad we're ending on the reserve fund for capital, and the tasers, the tactical, deactive shooting gear, HVAC, and the extrication equipment. I guess my question is, what do we have in free cash right now?
So-
And what's projected through the end of the year?
Yes.
And if we had, just for those four alone, that's $317,000. Wouldn't it be beneficial if we paid for those four items right there, reducing the number of, the amount of free cash that we're gonna infuse into this budget?
Yeah, to answer your first question, after this item came down, after the budget came down, we're at about 3 million. And then we're expecting to send about a project for about 1.5 million related to public safety communication systems that is going to be coming down here shortly. Our goal for the administration is always to kind of buffer about 10% of the free cash number into next year to give us some buffer. So we have a few other projects between the schools that we just met with at One City, One Budget that we're trying to move forward with, some of their HVAC improvements. And then a couple other smaller projects in talks with Derek and some of the park and zoo issues that we're trying to navigate through. So, we do expect about $2 million worth of projects to come down off of that 3, try to hold about 10% of our free cash to buffer to next year. The reasoning for this approach is exactly what I was saying before about the capital fall off. So I think it does, while effectively you're doing similar thing, right? At the end of the day, you're funding the projects. It's going to be about July 1 when those projects can be funded within 2 weeks by sending it down now or sending it down as part of the budget. And you're effectively using the same funding source.
Right.
I think my concern is I think it undersells the financial challenges that we actually have, because the reality is this is capital spend that's been in our budget for years, like this level of capital spend between debt service and capital. And if we allow that to fall out of the budget, we don't plan to have this level of capital spend going forward. I think we're sort of conflating the budget challenges we have by effectively using the one-time revenue right now over the next couple weeks versus the July 1 making a part of the budget. There's also other expenses that I think should be budgeted capital expenses annually around this price range, and you see those in the CIP. So the goal is going forward to sustain this level of capital, and you should see some of these smaller items directly in the department's budgets as well as in the reserve fund for capital. And ultimately, I think my recommendation is that the city continue to keep level non-excluded debt service / capital within the budget, and this represents that.
Additional questions? Deb?
Mason, on your comparative analysis, the $744,913 of capital funds last year, was that made up from the $500,000 in reserve, the $240 for the police vehicles?
Correct.
What's my minor?
The retrofit lights in citywide, which are no longer being utilized.
And I'm just asking, how much of last year's budget was balanced with free cash?
0.
Okay. So
that capital was funded on the budget last year.
so specifically the $240,000 for police vehicles was part of the regular operating budget,
Correct.
which it has been for.
Correct, for
Okay.
3 or 4 years, 4 years, I think.
So I understand your approach and trying to keep like a level, the level capital. I understand the approach. I just think that of the 744 last year, I want to make everybody aware, that it's really not apples to apples comparison, because last year nothing was from free cash.
That's
Right.
the whole point.
And yeah.
That's the
and-
entire point. Last year, we were able to fund this level of capital spend without free cash. The year before, the capital spend was about 500,000 higher, which also used 500,000 in free cash. So the goal of the administration is to ensure that we're not losing the capacity to fund the debt, which, by the way, is coming on in 28 and 29. And while, yes, we're relying on one-time revenues to balance this budget at the end of the day, if we pull it out of the budget, we're effectively creating an even bigger hole next year. And we're also, I think, telling the public that, you know, this is the level of debt service and capital spend that we should have in the budget, which I think is incorrect. I think if we reduce this, I think we're conflating the budget problem that we have to the public, and we're making it look like it's not as bad as it is. And I
But
think it's
would you
really
agree
important.
that in 28, it's actually the 937, right? We're using free cash. If you don't have the equivalent new revenue or additional
Exactly.
free cash, in 28, when your new debt comes on, you're either gonna have to give something up, right?
Mhm.
Or, I mean, once you borrow the money, you have to pay it, folks, right?
Exactly.
Like that's a given. That's one thing we can't cut, right? So.
Exactly. That's the intent. Is it
You know,
needs to be it needs to be known that, look, while we're relying on one-time revenues, this is the annual operating cost that is in the budget. Like, this debt's falling off this year, it's coming right back on.
Right.
And so we need to be able, like,
So-
it's truly a deficit budget, even though it's covered. Like, yes, it's balanced from the legal sense, but it's in deficit from the sense that, you know, we are using one-time revenues. And we'll, if we just, same thing next year with the additional debt service, we'd need even more one-time revenues.
In theory, if you had nothing else and you had to use the free cash, you'd forego potentially the $500,000
Yes.
in the reserve, and you'd be using free cash to fund a debt service payment of an equivalent $500,000, let's say.
Correct. Which is not a good strategy.
Can you at least speak, unless you want to do it a different A, right? But could you at least speak to why the approach was free cash and not the capital reserve stabilization and or regular stabilization funds?
Yeah, absolutely. So we didn't make a contribution to stabilization this year, and we talked about this recently. Actually, Council Vice President Dolan, you had asked about this in the fall when we were talking about a $2.5 to $3 million deficit and a potential holdback of free cash for the budget. You had asked, you know, well, does it make sense to use free cash or stabilization? What makes more sense? And I said, it makes more sense to not contribute to stabilization this year and utilize those, if needed for the budget, utilize free cash towards the budget. Because ultimately, at the end of the day, while our stabilization balance as a percentage of our operating budget will be lower at fiscal year end than it was at last fiscal year end as a percentage, that percentage difference is going to be relatively de minimis, and our balance will at least be higher net of interest. So from a ratings perspective, we look a lot better if we're using that as a one-time revenue source rather than dipping into our stabilization account, which, let's be honest, where things are headed, we could be looking at that next year, right? Especially if some of the solutions that we bring out with health insurance are multiple year solutions, it may take some stopgap measures to close that gap without otherwise drastic measures of shutting down certain operations in the city. So the approach was, we have free cash available this year. Let's use that as the source rather than stabilization. And to answer the question about capital stabilization, the project that we're about to propose for police and fire, which has been talked about by both the chiefs for a number of years, it's in multiple places in the CIP. The goal is to utilize free cash as initial seed funding, with then the intention of later for the remaining construction costs, which will be another $3 to $4 million once the project's engineered and designed, is to use a split of capital stabilization and potential loan authorization depending on the final costs. Just because those, that is an improvement life of like 20 to 30 years, so it makes sense to borrow for, but also we put funds in capital stabilization for a couple of large projects that ultimately we don't think we're gonna have to fund, which is positive. So that would probably be a funding source for that project, which is also actually stated in the CIP. So when you look at the funding sources, you can see capital stabilization listed on a couple projects. So.
Anything else for Mason? You're here with everyone else. You're on the hot seat by yourself.
On the hot seat.
Yeah, no, I appreciate everything. I appreciate you taking the questions. These are tough questions that we have to ask in order for us to understand. What I would say is I think the public's quite aware of the challenges we're facing with this budget. It's been pretty well reported, especially with some of the unfunded positions. So, all right, so Mason won't be here next Wednesday, Thursday. We did add Public Works to June 1st.
Perfect.
So thank you for your service. Stay safe. Thank you for all you do. That being said, I entertain a motion to adjourn. Thank you. All those in favor? Aye. We're adjourned at 7:39.